Caregivers often voice concerns regarding safety and side effects of newer systemic treatments for atopic dermatitis. What can clinicians do to better educate and reassure their patients and caregivers? And how does shared decision-making factor into this?
I think we're very fortunate now that we have a number of different options in our toolbox to treat specifically a moderate to severe atopic dermatitis. There's been a number of clinical trials that have included very young patients down to 6 months of age in some trials. And having that data from the clinical trial to show safety especially, and then efficacy as well, is very helpful in our discussions with parents. Many of the prior treatments that we've used for patients with atopic dermatitis do not have these large randomized trials showing safety. So we don't have that information to convey to parents. Luckily, these newer agents have gone through that process and we have that information. And as we get more real world use with these medications, we'll have more information as well to share with parents. It's important to also highlight that these medications, these newer systemic agents for atopic dermatitis, are a different approach to the treatment of atopic dermatitis. Prior to them being available, we've used a lot of very broad anti-inflammatory medications like topical steroids and other broad immunosuppressants to treat the disease. And these medications really represent a different approach, a more targeted approach that targets more of one part of the pathway in the pathogenesis of eczema. And that is, sometimes you can really explain that to parents at a very high level, and it's very helpful and reassuring.
Thank you. What gaps do you feel persist regarding the communication between clinicians and patients and caregivers?
I think there is still an issue with access. Sometimes it's difficult for these more moderate to severe patients to get into a pediatric dermatologist. And it depends on their geographic area, but there may not be a pediatric dermatologist in the area. They may have to see kind of a more hospital-based clinic where it's very busy and it's difficult to get in, so the access is an issue. In addition, certain providers that will be seeing these patients first line may not know that these treatments are available or that they exist, and so that's a gap also.
Absolutely. So what can clinicians do to address these gaps?
Education is very important, speaking to other colleagues, speaking at meetings like this, really keeping abreast and up to date with the current treatments and the upcoming treatments for managing severe skin disease in pediatric patients.
Thank you for your time today, Dr. Gonzalez. This was very, very informative. Is there anything else you'd like to add?
This meeting has been extremely well organized, very informational, very practical. So attendees can really come home with some key practical tips and take back into the office and implement them right away. It's been a very nice meeting.